Cardiac physiology is a key part of cardiology services in the NHS, with a specialist department at the University Hospital of Wales in Cardiff. But what is cardiac physiology? Cardiac physiologists perform a wide range of roles. They carry out diagnostic tests, treat patients in regular clinics, and aim to improve the quality of life for those who attend the department. They also work as part of a multidisciplinary team in operating theatres and in emergency situations to help those suffering from heart attacks and other serious cardiac events. So what does a cardiac physiologist actually do? The basis for much of what physiologists do concentrates on the ECG, or electrocardiogram. This records the electrical activity of the heart. It can be broken down into multiple components which reflect the activity of the atria, the top two chambers in the heart, and the ventricles, which are the bottom two chambers. An ECG is a non-invasive cardiac diagnostic test that is quick and painless to perform, from which the physiologist can calculate the patient's heart rate, and it provides key information to diagnose irregular heart rhythms and other conduction abnormalities. These are generally quite short recordings, with each standard printout recording 10 seconds of cardiac activity. For longer ECG recordings, physiologists also fit ambulatory monitors capable of recording the ECG over a period of several hours, days, and even weeks. When the patient returns their ambulatory ECG monitor, a cardiac physiologist will analyse the recording. The physiologist will then write a report to be sent to the requesting doctor. The results of these reports will often direct a patient's treatment or any further investigations. Depending on the presenting symptoms, some patients may have their ECG monitored whilst they exercise on a treadmill or special bicycle. These exercise tolerance tests allow a physiologist to assess how a person's heart rate and ECG changes when they exert themselves, and are often used to provoke irregular heart rhythms. Blood pressure is also important during exercise, so a physiologist will monitor a patient's blood pressure closely, mindful of any sudden drops or excessive increases. Everyone's blood pressure will of course vary throughout the day, so physiologists also fit monitors to assess a patient's blood pressure over a 24-hour period. When the patient returns their blood pressure monitor, a cardiac physiologist will review any high or low blood pressure recordings. Once again, the report written by the physiologist is sent to the requesting doctor, and that report will help inform further tests or treatment. In order to assess the structure and function of the heart, physiologists perform echocardiography scans. In much the same way as ultrasound is used to look at unborn babies, the same technique is used to look at the four chambers of the heart, the valves, and the muscular walls. These echo scans highlight abnormalities and can be used to assess how efficiently the heart is working, which will again inform further treatment or interventions. Depending on the results of the test performed by cardiac physiologists, patients may require further procedures which physiologists also assist with. For example, if a patient's ECG shows that they have particularly slow heart rates, then they might need a pacemaker, which prevents the heart from going slowly by stimulating the heart to beat. Alternatively, someone's heart might go very fast, and so we implant special devices known as defibrillators, which will shock them out of that fast and potentially life-threatening heart rhythm. Physiologists not only assist with the initial implantation, but also run clinics to regularly check cardiac devices. Other patients may have different changes on their ECG, which indicate narrowings or blockages in the arteries that supply blood to the heart muscle, commonly known as a heart attack. Physiologists then work as part of a multidisciplinary team with nurses, radiographers and cardiologists to open up these narrowings. Cardiac physiology is an exciting career choice, working on the front line of the NHS. Every day is different, and every patient is important.